A growing and deeply concerning public health crisis is unfolding, one that has largely gone unnoticed despite its deadly consequences. Human papillomavirus, HPV, is surging among men, fueling a sharp rise in cancers of the throat, tongue, and other areas of the body. While HPV has long been associated with cervical cancer in women, a new survey from the Ohio State University Comprehensive Cancer Center reveals a disturbing truth. Men are actually more likely to be infected, yet awareness remains dangerously low. This lack of knowledge, combined with low vaccination rates, is allowing preventable cancers to spread at an alarming rate. The study highlights a shocking gap in public understanding. Nearly half of respondents did not realize that HPV is responsible for cancers beyond the cervix, despite overwhelming scientific evidence linking the virus to a variety of malignancies, including those affecting the tonsils, throat, neck, esophagus, anus, and genitals. Even more troubling, 42% incorrectly believed that HPV is more common in women, when in reality, men are more frequently infected. Perhaps most dangerously, 40% assumed that an HPV infection would produce noticeable symptoms, not realizing that many cases remain silent until cancer has already developed. This widespread misinformation is leaving millions of people unknowingly vulnerable. The consequences of this ignorance are devastating. Right now, an estimated 42 million Americans are infected with HPV, and a staggering 98% of the population has been exposed at some point. The virus spreads easily through sexual contact, including saliva and other bodily fluids, and even from mother to child during birth. In many cases, the immune system clears the infection, but for those who cannot fight it off, the long-term effects can be deadly. The virus causes genetic mutations in cells, which, over the course of years or even decades, can lead to cancer. Without a reliable test for HPV in men, most infections go unnoticed until it's too late. One of the most alarming trends is the explosion of oropharyngeal cancers, which affect the tonsils and the base of the tongue. If current trends continue, these HPV-related cancers could soon become one of the 3 most common cancers among middle-aged men in the United States. Even worse, projections indicate that within the next 10 years, these malignancies could become the most frequently diagnosed cancer in elderly men. This rapid increase represents a looming crisis that, if left unchecked, will result in immense suffering and loss of life. Despite the availability of a highly effective vaccine that can prevent up to 90% of HPV-related cancers, vaccination rates remain critically low, especially among men. The Centers for Disease Control and Prevention, CDC, recommends that children receive the vaccine between the ages of 9 and 12 for maximum effectiveness, but vaccination rates remain disappointingly low. While 56.9% of eligible children have received the vaccine, the majority of those are girls. Boys and men, who are at equal or greater risk, continue to be neglected in HPV prevention efforts. Worse still, many adults remain unaware that the vaccine is available to people up to the age of 45. Doctors and researchers are sounding the alarm, but awareness alone will not be enough to curb this epidemic. Without widespread vaccination, millions will remain at risk, and the burden of HPV-related cancers will continue to grow. Unlike other infectious diseases, there is no cure for HPV once a person is infected. No medication, no therapy, and no reliable screening test for men. The only truly effective defense is prevention, yet countless individuals continue to leave themselves vulnerable. The failure to address HPV in men is a public health disaster in the making. Ignorance, stigma, and inaction are allowing a preventable epidemic to spiral out of control. If the medical community, public health officials, and policymakers do not take immediate steps to increase vaccination rates, the consequences will be catastrophic. HPV-related cancers will continue to rise. More people will suffer and die needlessly, and a crisis that could have been prevented will become an unavoidable reality. The facts are clear. HPV is not just a women's issue. It is a serious and growing threat to men's health, one that demands urgent action. The time for complacency has long passed. Unless vaccination efforts are drastically expanded, we will be facing an explosion of preventable cancers in the coming decades. The choice is simple: act now or allow this silent epidemic to claim even more lives.